Okay, well, welcome everyone to the Invisibly Aware Series guest speaker meeting on neurological disorders and what it's like to live with them. This is coming to you from the Invisible Illness Awareness Network. My name is Annika. I am a white woman with dark brown hair, and today I'm wearing a light blue collared shirt. And I'm going to be presenting today with Morgan. Morgan, if you want to introduce yourself.
Hi everyone, my name is Morgan. I am a white woman with long dark brown hair as well, and I'm wearing a white sweatshirt.
So we do like to give as much accessibility to our viewers as possible. So we will do verbal image descriptions for any images that we have, and we would like our guest speakers to also describe themselves as we just did. There are captions available, which you can turn on in the bottom of the panel by clicking the CC button. And if there are any other accommodation needs, please let us know in the chat, and we will do our best to accommodate you however is needed. Before we get started, there are some important disclaimers that we need to have. First off, this is not medical advice. If you have legitimate medical questions, please consult your doctor for whatever medical concerns you have. And it's important to keep in mind that every person within a condition is unique, and even among individuals who have the same diagnosis, they might not have the exact same experience. So you can't expect things to always be the same across within a diagnostic category. And we are not experts on these topics, although we have researched them and read about them pretty well, and our guest speakers have lived with them. So, what is the Invisible Illness Awareness Network? We are a 501c3 nonprofit raising awareness about invisible illnesses, chronic illnesses, and disabilities. And we specifically support students starting affiliate organizations at universities to become leaders, educate their peers, and to foster inclusive environments throughout their communities. What is the Invisibly Aware series? You're here. The Invisibly Aware series holds actually just one virtual event a month on Zoom at this moment, which is our guest speaker event, which is where we highlight the lived experiences and professional expertise of those who have significant amount of knowledge about any particular topic that we are focused on. Please follow us on social media. We have the Instagrams for the Invisible Illness Network, as well as the Invisibly Aware series here. And you can also check us out on YouTube to see recordings of our guest speaker meetings. You can also find us on our website, iianetwork.org. And you can scan the QR code to find the link tree for more links, including our newsletter sign up. Questions are always welcome. Feel free to ask questions in the chat at any time throughout the presentation, and we will answer all questions to the best of our knowledge. And specifically, we will have time at the end to answer any questions that are currently present. And with that, I'm going to pass it off to Morgan, who's going to explain our current conditions we're talking about today.
Hi again, everyone. First here, we're going to be talking about one of our first conditions was this tethered cord syndrome, also known as TCS. And so tethered cord syndrome is an abnormality when the tissue of the spinal cord is stretched, and it limits the movement of the individual who has the condition. And so it can be caused by a variety of different things. Most commonly, it is congenital, so the person is born with the condition, or it can be acquired through various things such as infection, tumor, injury, or post-surgical complications. Symptoms for patients often tend to be back and leg pain, leg numbness and weakness, muscle atrophy, so weakening of the muscles, and bladder and bowel dysfunction. If the condition does go untreated, there are several complications that may occur, such as nerve damage, loss of movement, and as we mentioned, the dysfunction to control the bladder and bowels. The prevalence of this condition is not exactly known, but it is estimated to be about 2 in every 1,000 births. And so to treat the condition, normally surgery is the best option, and this is done to, again, fix the attachment of the spinal cord. But sometimes patients can redevelop the attachment, so surgery may need to be repeated if that does happen. And the other condition we're going to talk about tonight is epilepsy. And this occurs when there's a disruption of the normal brain electrical activity, and it causes bursts of the electrical signals, which can create a wide variety of symptoms. Since the brain communicates using electrical signals, it's really important and can be really impactful when this does not work as expected. And this can cause seizures, changes in consciousness, and severe convulsions. And so the prevalence for epilepsy is about 50 million people worldwide. And there are a wide variety of treatments. Normally, medications are used. Some surgeries can also be useful as well, alongside dietary changes and devices to control the seizures. Complications can result from epilepsy as well, such as injury, brain damage, and sudden unexpected death in epilepsy, which is really a concern for people who don't have the condition controlled well. And then no, it's really important to know that epilepsy is not the only cause of seizures either. There are other conditions that can cause it, but it is one of the most prevalent. Alrighty, so now we're going to go ahead and transition to our guest speakers. So the first speaker we have is Ada, and you can find her at Ada Ostomy on Instagram. And our second speaker is going to be Gracie, and that's at Gracie Mansueto on Instagram as well. So I'm going to go ahead and open the floor to them and ask that they go ahead and also introduce themselves briefly.
I'm Ada. I am a white woman with blonde hair. I'm wearing glasses and a brown t-shirt. I'm originally, I guess I was born in Maryland, but have lived in Indiana most of my life. So I went to undergrad at IU Bloomington, and then I started medical school up in Indianapolis, and I'm currently a third-year medical student. In my free time, when I'm not studying, I enjoy spending time outside, especially in the summer. I hate the winter. And I also enjoy dance and hanging out with my cat, who you might see if you're watching the YouTube video.
Thank you for introducing yourself. If we could also have Gracie do so, that would be great.
Hi, I'm Gracie. I'm a white woman with dark brown hair, and I'm wearing a light brown t-shirt. I am from the Bay Area, born and raised there, and then I went to Loyola Chicago. I just graduated there this year. I really want to go to PA school, but I don't have enough clinical hours to apply yet, so that's my next goal. I'm moving back to Chicago in August, so I'm hoping to do that, like get my clinical hours there and then apply within the next few years.
Great. Well, congrats on graduating from school. That's wonderful. You want to be PA. I'm also pre-PA as well, so I appreciate that.
Awesome.
Um, So I'll go ahead and then jump into our first question here. So, if you guys would be willing to share on your experiences, what it's like living with an invisible illness, chronic illness, and or your disability. So, some things that you might want to talk about. When did you start experiencing your symptoms? Maybe a brief description of how your condition affects you, and just what it's like to maybe live with the condition. And if we could start with Ada on that one as well.
Sure. So, um, I guess my primary diagnosis is hypermobile Ehlers-Danlos syndrome. It's a mouthful, or HEDS as it's oftentimes known. I first started experiencing symptoms of that when I was pretty young, around age 11 or so, but I was misdiagnosed as having like probable lupus. So I went for like a decade not really having a diagnosis, not really knowing what was going on with me until about my sophomore year of college. And that's when EDS was mentioned to me in a Facebook group, and I Googled it and I saw the really stretchy skin, and I thought, there's no way I could ever have that. And then the more I thought about it and read about it, I was like, well, actually, maybe. And maybe this also explains a lot of my family's medical history. So flash forward, I got diagnosed with that in the summer of 2022. And at that same time, I was experiencing symptoms of tethered cord syndrome, but I did not know what that was at the time. So my symptoms really started with really persistent lower back pain. It would start pretty much from the second I woke up and just continue to worsen throughout the day. It was at its worst when I was standing for too long or sitting for too long. So I kind of constantly just had to like move around, get up and down. I was always like shifting positions, could never find a spot that was comfortable. My symptoms kind of snowballed from there. I started experiencing a lot of bladder and bowel issues. So, I mean, I was just peeing constantly. A lot of like frequency, urgency, like bladder spasms. I had pretty severe GI issues at the time. I was just constantly constipated and like failed all like prescription laxatives and pelvic floor physical therapy, and they sent me to do all the things and none of it helped. So aside from that, I also was having a lot of like leg numbness, tingling, so basically a whole constellation of issues, but no one had ever mentioned tethered cord to me. And I actually learned about it online just through following people who had EDS who also had tethered cord. And after doing a lot of research on it, I ended up flying to Rhode Island to meet with Dr. Petra Klinga, who is one of the, I would say, kind of the specialists in like the EDS world of treating tethered cord. And in addition to all my symptoms and other kind of bladder testing I had done, and then she did a neurological exam, that's when I was officially diagnosed and had surgery about a month later.
Yeah, no, I feel like what you said about having to kind of search for answers yourself, especially like in online communities and other people kind of telling you, hey, you should look out for that, is something we hear about with a lot of the people that we come to guest speak, and I think some of us as well who help with IIN. So that's definitely a common and shared experience. So I'm so sorry to hear that you went through that, but I'm happy that you did get a diagnosis and surgery to hopefully help with your symptoms.
Yeah.
Hi. I have epilepsy. And I first started having seizures, I think around like fourth or fifth grade. And then I was diagnosed with epilepsy pretty soon after that because I always started having them pretty regularly. I have like full tonic-clonic seizures, or some people know them as grand mal seizures, but it's not really said anymore. Um, and yeah, and I started having them. They put me on this one medicine called Keppra, and it sort of helped. Like it was reducing the seizures, but I was still having them. But it had a lot of effects on like my mood and stuff, and I was just really all over the place and feeling bad, and it just wasn't really helping, and it was kind of messing with my hormones and my weight and stuff. And then so I ended up going on a different one called lamotrigine, which I'm still on now, and that one ended up helping me for a long time, and I didn't have any seizures for like years. But then in high school, I had another one again, like a breakthrough seizure. So that was kind of sad. And then I started having them again, so it was a little confusing. And then at that point as well, I was kind of transitioning for different neurologists. I had a pediatric one, and then I got a adult one. And then they also transferred me to a specialist, not just a neurologist, but like an epileptologist. So I started seeing one, they put me on another medicine as well called zonisamide. So I'm on both lamotrigine and zonisamide, and that's been working for me. So I haven't had any seizures in a few years, so that's good. My symptoms are usually when I have it, I bite my tongue really hard, so my sometimes it's a little scary for people because sometimes there'll be like blood out of my mouth, you know. And then I unfortunately don't get an aura, so it's just that's scary for my parents because I kind of just like drop, you know. I don't really have any warning. Um, but yeah, besides that, that's kind of my see right now I'm doing well, so I'm really thankful for that. Yeah.
Yeah, I'm thankful for that too. I it's interesting to hear about. I'm wondering if we could both focus a little bit on the diagnoses that you've both gotten. I know you both mentioned them a little bit, but um, can you give us a little bit more specifics about how long it took you to seek help after noticing your symptoms, and how many doctors it took to receive your diagnosis, and what was your emotional reaction to finally having a diagnosis?
Gosh, I would say, I guess my getting a diagnosis was tricky for me because I feel like I had so many like compounding symptoms that could have been explained by so many different things. So, having already like knowing at the time that I had EDS, chronic pain is very common, along with GI and bladder issues. It's not necessarily always tethered cord syndrome. It can be a lot of different things. So that made kind of seeking out a diagnosis difficult and kind of teasing out, okay, what's really like not normal, what's kind of recently changed, what maybe could be explained by something else. And I think that that's kind of always the battle with EDS. A lot of people have many comorbid conditions, and not everyone has the same ones. So it's very hectic. I also, at the time, didn't really have anyone managing my care who really kind of understood all the comorbidities of EDS. I have a geneticist now who's like really familiar, and from the first appointment will kind of be prompting patients and asking them questions that I now know could be signs of tethered cord or cranial cervical instability or a variety of different things. So she really looks out for those. I didn't have anyone doing that for me at the time, so it really was all falling on me. So I would say I had symptoms for, it's hard to tell exactly, but maybe about like 3 or so years, kind of leading up to my diagnosis of EDS, because that obviously took a while to get. So looking back now, I can see that maybe things had kind of started a couple years prior and then just continued to worsen because tethered cord is considered progressive when left untreated. People can lose the ability to walk. It can be pretty severe. It's part of the reason that I now have an ostomy bag. I also have other GI comorbidities that probably piled on top of the problem. We'll never really know. But yeah, so looking back, it kind of started a while before. And getting a diagnosis, I think I just had a lot of self-doubt. I thought, am I crazy for like flying all the way to Rhode Island to see this specialist, to see if I have this, rare genetic, rare neurological disorder. Is very, sometimes it feels like, am I wasting my time? Am I looking for things that aren't there? So getting that diagnosis was very validating. And I remember distinctly, the day before my surgery, I'm driving to Rhode Island with my mom, and the surgeon calls me to go over pre-op questions. And she was like, I was reviewing your case, like it's very severe. And a lot of people would maybe not want to hear your case is very severe, but when you've been living with it, to have a professional who specializes in that tell you, like, yes, I see you, like I hear you, like this has really affected you, that was actually really validating to me, and that moment has kind of always stuck with me since. I can't remember if there's another part to your question.
I think you're good. Gracie, do you want to add in?
Yeah. I think I was lucky in the sense where it didn't take like years and years and years for me to find a diagnosis. Like I was having pretty consistent seizures and they're like, this is probably epilepsy. Like, I didn't have a, they did an MRI, I didn't have a tumor, I wasn't diabetic, stuff like that. So um, but I think the hardest part was, especially because I was kind of young when it happened, was just coming to the terms, especially because it was uncontrolled at that point, like for a while, that I can't do a lot of the stuff that I was able to do before. I was always very, like, I loved hiking and rock climbing and doing all this stuff or whatever. And it's just like, when you tell like a 11-year-old, it's like, well, you can't just go do that anymore. What if you have a seizure and fall and die and stuff? And it's like it's fine now. I'm very fortunate in the sense where I'm very stable. I've seemingly found a medication that has been working for me, and I can really, like, I've been able to go through my daily life. Like there are so many people who like have epilepsy and don't have that at all. But I think that when I first started having seizures and was diagnosed, like that was just really hard for me to accept. And also because the medicine that I was put on was very much not helping with my mood either. I was probably just like, I was not helpful to my parents either. And it's just. So that was, I think, the hardest part, coming to terms with that. I'm like, it sucks, but oh well, like you'll get over it. And I did. I think I'm in a good place now. So,
Well, I'm happy to hear you're in a good place now, and again that it's been more well controlled recently. And so I think you touched on a lot our next question as well, which is basically kind of talking about how your life has changed since your symptoms started. I know you're saying that you weren't able to do everything as much as you wanted to, and especially about your mood as well. So I would love to maybe hear a little bit more about that, and also from you as well, Ada, about like how your symptoms might have changed and over the years and the challenges you face, and basically what has this condition taught you about yourself since being diagnosed, and the whole journey of what it's been to live with it.
I think I just have to be a lot more cautious or like cognizant of things, I guess, that I didn't have to before, just where I'm standing or like where, if I'm on a platform and fall and stuff. I mean, I'm more I feel safer now, I don't constantly think I'm gonna drop and have a seizure, but it's also for the fact that like I don't get an aura at all. So, I mean, for some my sister also has epilepsy actually. And hers is interesting in the fact where she like consistently only has seizures like right when she wakes up. So it's like it's I mean, hers unfortunately is not very well contained right now. Um but I guess it's for my what I've spoken to with my mom, she's like she scares me way less because she's like I can bet on when it's going to happen for her. With you, it's just like, and so that is something that I've had to kind of just take into consideration in like my life, um just being more careful, I guess. And also, this is just one small thing. Sometimes it's like, I really wish I could drive. Like, I can't, and it's fine. Like, I'm moving, I live in Chicago. It's a very easily accessible city, but sometimes it's like, am I really gonna be 25 asking my mom to drive me to the grocery store? Like, you know, like, yeah, so it's just things like that, but it's okay. Like, one day I'll get my own Waymo.
I liked what Gracie said about being kind of more like cognizant and just having to be like aware of your surroundings. Um, Tethered cord, yeah, it affects everyone very differently. So for me, I really had a lot of like GI and urinary issues. And then the chronic pain, I'd say those three were kind of my top main issues going into surgery. And I was told, surgery will hopefully improve your pain. It might improve some of your symptoms, but we don't expect everything to just go away because a lot of, the neurological damage that's done to those lower nerves can be permanent. So I would say my pain has improved, but definitely has by no means gone away. I struggle with chronic pain, especially my back pain. It's a huge point of issue for me. It's a challenge right now because I'm in my surgery rotation and I'm expected to stand in the OR for hours on end. So that's been interesting to navigate. And I think it takes a lot of like pre-planning. So like anticipating your pain and what you're going to do beforehand to minimize your pain, what you're doing during, and what you can do after. So, am I taking pain meds before? Am I going to put on like a lidocaine patch? Am I going to wear, my back brace when I'm in the OR? What am I doing later that evening? Am I going to be able to just like lay down with my heating pad, or do I have somewhere to be? Like kind of just always thinking ahead takes up a lot of brain space that I think all people with chronic illnesses understand. So that's been, I think, an ongoing like adjustment in my life that as your life changes, you continue to have to try to figure out how to navigate. It used to be, sitting in a classroom or sitting taking tests for hours on end caused me a lot of pain in my legs from the tethered cord. So I would bring seating cushions, or I would, make sure I had accommodations to take extra breaks so I could walk around and things like that. So it's kind of like no matter where you are, your life looks different. I also have like the urinary issues and then the ostomy bag. So that also takes a lot of planning ahead of time, making sure I have supplies on me. Do I know where the closest restroom is? Kind of trying to time when are those good breaks to go. That's all also something that kind of always plays on your mind. And it definitely gets easier with time. And I do have like disability accommodations at school and will wherever I end up working one day. So that's been something that's been really helpful, but not an easy process to navigate necessarily.
Yeah, it doesn't sound like it, but it is interesting to me how even though both of your conditions are neurological, they're very different clearly, and yet they still have a very active presence in both of your lives and have this like daily impact, it seems. You both did touch on this already, but just in case there are other things you might want to mention, we did want to ask about the treatments that you've tried that you're willing to talk about, what has worked and hasn't worked. Ada, you mentioned surgery. Gracie, you mentioned medication, and neither seem totally perfect, but do you want to expand on those at all?
Sure. So tethered cord specifically, when it's diagnosed, surgery is, from my understanding, typically done. If they're kind of on the fence on if you have tethered cord or not, they might continue to monitor you for a while. But if you have, the signs on, so they do like bladder testing to look for kind of like neurogenic bladder. If you have signs of that, if there's any abnormalities in your neurological exam, and then if you have, the presenting symptoms, then surgery is typically done just because things usually do progress. So once I was diagnosed, it was decided you're a good candidate for surgery. We're going to move forward with that. But like I said, a lot of times people's issues aren't completely cured with surgery. So after surgery comes the questions of what else, is left that we need to do. So I already actually had an ostomy bag. I just didn't really know why I needed it. So that part of the puzzle was kind of already solved for me, but for patients who would have lingering, bladder bowel issues, those are steps that might need to be considered if things like pelvic floor physical therapy and medications weren't helping them anymore. So I'd kind of already exhausted all those options before surgery. So I'd already had an ostomy bag and kind of gone through all of that. Other than that, a lot of the times like physical therapy is needed. So I'm actually just now starting PT for my back, even though it's been a couple of years. I don't know why I didn't do it sooner. Um, so I'm doing PT for my back pain, but some patients might need physical therapy for issues with like mobility, especially if they've had a lot of weakness in their legs or lost, muscle mass and need to build up that strength again. PT is definitely very common for those issues as well.
Yeah, for me, it was mostly just medication. I have generalized epilepsy, so they can't pinpoint in my brain like where the misfiring would happen, so they can't like give me a surgery to, fix that. And yeah, it took, like I said, it took a little bit to find the medication cocktail that has worked for me, but I'm lucky that I have found one that has been working for me for a few years. I also do have to just be cognizant about like my daily routine and stuff though. Like sleep is really important. If I don't get, I mean, if I one or two nights it's okay. I'm not gonna like immediately have a seizure. But if I go a prolonged time with having bad rest and stuff like that, then that can trigger a seizure, like a lot of stress and things like that. So like final season was always like I gotta I gotta make sure to take care of myself. And my sister, as I previously mentioned, she also has epilepsy, but she has a VNS, a vagus nerve stimulator. So that's a surgery. It basically, they put this thing in and it sends like stimulations on her vagus nerve up to her brain. And the idea is that it can like when the misfire happens, it can either, well, ultimately try to prevent it altogether, but at least make the seizure less, or like it's happening but it stops it. And it's really cool because it has not completely stopped her seizures, but it has helped them, because she would have seizures, and the issue with hers is that she wouldn't come out of them. Like, she would keep having them, you know? And you can trigger it, firing it with a magnet, and when you would wave the magnet over it, they would stop. It's like it really, it has been pretty effective, so that's been interesting. And it's interesting because they said that it's not usually something they used for generalized epilepsy, but they wanted to try it for her, and it has helped her a lot. So that's pretty cool. But that's one of the that's something that they do for that's an epilepsy treatment, vagus nerve stimulator.
That's really cool. I didn't even know that was a thing. I knew about the simulators, but I didn't know about the waving the magnets. So I'm happy to hear that your sister has had success with that. And again, the medications alone have been enough for you. We're really curious to learn about, with both of you, what challenges you face within the healthcare system, especially with, a longer educational journey or working in different workplaces. I know Ada, you're in medical school right now, and Gracie, you just graduated, so I'm sure you both have a lot you can kind of share in that regard. So, especially in regards to any stigma or discrimination, again, with professors or just the academic experience. So,
I'll go, sure. So, oh gosh, EDS is just very complicated. It's very misunderstood by most healthcare professionals. As a medical student, I can tell you that, through my entire first 2 years of preclinical education, we had one slide on EDS. And it wasn't even like a slide dedicated to EDS. It was like a little picture in the corner. And it was like, oh, this affects like type 1 collagen, as if there aren't like 13 different types of EDS that affect a bunch of different types of collagen. It just was like, yep, one thing. And the lack of education on also just stems from the fact that it takes a while for board exams to catch up with more relevant material. So we used to think that EDS was super, super rare. And for some reason, the boards would also kind of cherry pick certain other conditions like Marfan's or like osteogenesis imperfecta, other connective tissue and collagen disorders. And EDS, maybe because there are different types and it's a bit more complicated, usually just gets left off. So it's not that I've never seen a board question on it, but it definitely doesn't come up as much. So it's not really taught in schools. So a lot of doctors, have heard of it, but they'll kind of look at me and go, oh, well, isn't like you're just too bendy? Like, it's a lot more than being bendy. And then you kind of compound these more rare comorbidities like tethered cord. And now they're just really in over their head because they usually think of tethered cord as, only kind of the congenital form that you're born with. And it's only more recently being recognized in EDS patients because it presents differently. It's not, you don't usually have spina bifida per se. You kind of develop it over time. And oftentimes your MRIs are normal. So I have what's called occult tethered cord syndrome, which is the type that probably the majority of EDS patients have. And, it's because that little piece of tissue that's become, either like adhered or too stiff or whatever is made of collagen, but you can't necessarily see those abnormalities on an MRI. So I, really kind of seeing people locally didn't feel like an option. I felt like I had to go to someone who understood EDS, who I knew would, evaluate me properly, because your regular neurologist or neurosurgeon would look at your MRI and go, looks great, you're fine. And, kind of not be looking for these other signs that are associating it with your underlying genetic condition. So in that sense, getting a diagnosis was a lot more complicated. It took a lot more like research on my end. And I could say that that's kind of been the trend throughout my like chronic illness journey, especially just because a lot of these conditions are not well understood. And at first, I was pretty much just gaslit or told that, I was fine, take more Miralax, do more pelvic floor PT. And then with time, as I kind of accumulated these, diagnoses and had these surgeries, I went from kind of being like, I don't know what's wrong with you to like, I don't know what to do with you because you're too complicated. So it was really like a 180-degree shift that happened, which has been interesting to navigate for sure.
I haven't like had any um okay, I'll start over. Um, I've I had a really good experience at Loyola in terms of like their disability accommodations and stuff, so I'm really thankful for that. My freshman year I had a seizure in class, which sucked. But the professor was great. Shout out Jason Cummings. So I mean, I am appreciative for like what they did for me. Um, I had a lot of support there. Um, so I am thankful for that. I know a lot of people do not have the same experience at their schools or at their workplace and stuff. I haven't really had a like the opportunity, I guess, to have see I'll see maybe in the next few months I'll get back to you about workplace experiences, you know. Um, but so far, like I've been really lucky in the fact that it hasn't been too um like I've just been surrounded by a lot of good people, I think. Lucky for me. One thing I will say, I guess, that like going back to the driving, I got my EMT license. I'd like to be an ER tech, but I if I wanted to do EMT, like I can't really because I can't drive, you know, or at least it would be a lot more difficult for me because it's like I can't, you know. So it's just little things like that, you know, which isn't necessarily like a they're not hiring me because of my disability, but it's like, well, if you can't drive, then it's like, you know what I mean? I don't know. So it sucks, but it's like I'll find a way around it.
I appreciate that attitude. It is complicated because whether it's not exactly discrimination, of course, but it is, keeping in mind your limitations, but you clearly are not just your limitations. So, and Ada, it's really interesting to hear about the medical student perspective on learning about a condition that you have. And I'm starting med school in a week, so I'm really curious to see what that's going to look like from my school's perspective. But from my understanding, it's probably going to be relatively similar with EDS and probably tethered cord syndrome. Fingers crossed. But yeah, I think a lot of these things come down to how the general public perceives things, and hopefully the more we talk about them, the more we can lead that to like a wider understanding of the conditions that you guys have. But right now, in your experiences, are there any specific misconceptions about the conditions that you have, specifically tethered cord and epilepsy? And are there any ways that you would recommend that we challenge them as community members?
That's a good question. Gracie, do you want to go first?
Mm, Sure. Um, I think that the view on epilepsy has come a crazy long way. I mean, I was actually talking about this with my dad the other day. I was like, if I was born 50 years ago or something, like I would be institutionalized right now. Like people thought people with epilepsy were like possessed by demons, you know? So it's like it's really I was talking about well, the way this came about actually is because I saw one of those in Instagram posts and it was like I was born in the wrong generation. I should have been born in the whatever and stuff, you know. And I was like really thinking about it because I was like I really am so lucky to be born in the time that I am because any other time, like, like without the medical care that is offered to me, I really would that be it, you know what I mean? Like, so I really am very fortunate for and also just the fact that I am able to receive that. I know many people are not. Um so I think just within the past few decades, like the change and stuff. But there's still a lot of, I think one thing um is how to, this isn't necessarily just epilepsy in particular, but I just say seizures. I think a lot of people, I think it's important to make aware how to address when someone is having a seizure. I mean, I've known a lot of people who still think you're supposed to like stick something in their mouth. I'm like, that's the last thing you want to do. Um, so I think, yeah, roll them on their side, get anything out of the way and stuff like that. So I think that could be an important people thing to teach people, make more people aware, because it really is like a lot of, like you mentioned before, like epilepsy is not the only cause of seizures. Like, febrile seizures, tons of kids have those. Um, people like diabetic people, so it's lots of causes for seizures. So I think um the way to handle if someone you see someone having one, or someone or just after it, because people can be really confused and stuff after it. So I don't know, maybe making more aware of how to like help someone when they're having a seizure could be something, I guess. I don't know.
I thought those were all great points. And I agree. I mean, I think in medical school, like we learned about epilepsy, but they don't really teach you like how should you help someone who is actively having a seizure properly. There's so many different ways seizures can look, and it's like you only have so much time in school to talk about it. So um, I agree. We definitely need more education on that. In terms of tethered cord, it can present so differently. I feel like I keep saying that, but that's just because it's the truth. So I guess like I can speak from like my perspective and the ways it's affected me when I was applying, when I'd been accepted to medical school and I was applying for disability accommodations. I filled out this form that my doctor signed off on, and I was very honest on this form because I thought, well, I really need these accommodations, so I'm just going to be like not brutally honest. I'm just going to tell the truth about like what I need and why exactly I need it. And, I was worried that they weren't going to want to give me accommodations or something. And so I fill out this form, and then I'm, connected with the disability coordinator. And I'm told we're going to have this meeting and yada, yada. So some team of people, I don't know who exactly, some team of people had met to discuss my application and if they were going to give me these accommodations. And I was basically told, yes, we will give you these accommodations, but there's concern over your ability to complete the program. And I was like, well, I've already been accepted to your program. They were like, no, we know, we understand. It's just, they were just kind of shocked by the severity of your case. That's what I was told. And I was like, okay, like I don't really know what you want me to say to that. You want me to argue my case? You want me to, kind of, it really put me in this like position of I was like, okay, like I either kind of like sit here and take them telling me these people said that, you can't do it, or I just say, screw that. So, I had this meeting and they were kind of giving me all these scenarios. They're like, well, what are you going to do if there's like a line for the restroom and, you have to go? I was like, cut the line? I've done that before. It's kind of straightforward. If you ask me, find another bathroom, like, I don't know. Or, well, if, you have these dietary restrictions and everyone's eating food you can't eat, like, are you just going to leave? It's like, you think I'm gonna leave if I like can't eat the pizza? Like I bring my own lunch. Like it was just kind of these questions that felt so simple. And I think that anyone with a disability or chronic illness is, used to navigating these things every single day. And it was clear that, you know, these people running these accommodations or these people in the medical setting really have no idea about what it's like to live with a chronic illness or disability. And it was really discouraging because I thought, well, these are the people that are supposed to be helping me. And, you know, they're telling me off the bat that, well, some people think you can't do it. So that was kind of like my introduction to the program. And it was a rocky start. I think what I can say is that every, you know, physician that I've actually worked with, every mentor I've had, all of my peers have been awesome. They've been incredible. They've been super accommodating, very understanding. You know, even in surgery rotation, I was very nervous about my accommodations, about saying, well, I'm going to have to sit down because I cannot stand for 6 hours straight. And they were like, great, go sit down when you need to. Great, scrub out, we'll scrub you back in if you have to go to the bathroom. It's no problem. So just being really clear with my communication with them and all that has gone very well. But I do think that there's, you know, a lot of stigma, maybe from the administrative end, a lot of the time in programs, because they're thinking, well, can you do this? You know, whereas a physician would say, great, you're here, cool, like, do what you need. So I think a lot more awareness is needed for just, you know, managing accommodations, how we can make it easier on people to get them, how we can help bridge those conversations between student and, you know, physician, student and mentor, so that the student doesn't have to do all of the work, like kind of just more structure to these um, disability accommodations. And obviously not every institution is like this. You know, it varies. I think IU undergrad did a really good job and had a huge disability office, but especially in these professional programs, I think that there's not that many disabled or chronically ill people. And I think that there's a reason for that.
Yeah, no, you bring up an excellent point and definitely speak to a greater issue in our educational and healthcare system about not having the representation of, you know, providers who have experienced what it's like to struggle with these issues so that they can relate to their patients, and often how there's so many misconceptions about how and why, you know, like these people go about managing their care. And it's, at the end of the day, we are the experts on our own body. Like, we know how, like, what we can do and how we can do it best. And so hopefully, as you said, there can be more advocacy and knowledge shared with these people to uh, understand that just because you have an illness doesn't mean that you can't do all these things. It is possible. It might look slightly different, but it is possible. So thank you for sharing that with both of you. And so as we start to wrap up things here, I guess our next question here is going to be about advice you might want to give people. So advice for, and I guess what would be your piece of advice, or what would you want people, if you wanted people to know one thing about your condition, so specifically maybe anyone who's suspected of having this condition or thinking they might have your condition, or other healthcare providers, or just the general public, what is it that you would want them to take away or know about your experience and your condition specifically?
Um, I think I had a really hard time like coming to terms with it, and I was maybe even embarrassed, I guess. And I was young when I was diagnosed, but I didn't want to tell anyone. I was like, this is so embarrassing. I hate this. Like, what? But it's like, there's nothing to be embarrassed about. Like, this is unfortunately a part of you, you know? Um, and it's easy to say from someone who's like in a good spot and has been dealing with it for a long time, but it's kind of like, you just gotta accept it. And once you do, like it gets a lot easier, I guess. And there are some things that suck, but like you can get in any national park for free for the rest of your life. So like there are some perks, I guess. Like I think when it got easier for me is when I just came to terms with it. I was like, there are some things that are going to be different. There are some things that I can't do the same as before, but that's how it is. and it's gonna be fine. And like people don't care. You're not gonna point at and laugh at you. It's like not a K-drama, like, you know what I mean? Not gonna pour milk over your head, like it's fine, you know? So, yeah.
I think I would have to say for anyone who is maybe kind of trying to find answers to what they're going through. I mean, I think I've dealt with a lot of just feeling like a fraud. Like I just felt like I was crazy for just like trying to find an answer to these symptoms and reading all this stuff and searching. And it was almost like, am I searching for a problem? And it's like, you're not searching for a problem. You're just searching for something to explain the real problems you're having. And I think that's a very distinct difference that the line oftentimes get blurred, especially with conditions like tethered cord that are more rare, that are oftentimes like not understood or overlooked. So I would just say if you are, experiencing symptoms that you think might be tethered cord or maybe just something else that's more uncommon, there's nothing wrong with wanting to be evaluated for those conditions. There's nothing wrong with seeking a second opinion if you don't feel like the first person truly, hears you out and actually properly evaluates you. And I think that that's something that I wish I could have told like younger me who was really struggling, because there's a lot of value to having a diagnosis. And sometimes it's like, oh, like, well, why do you need a diagnosis? Like, you know, and it's kind of like sometimes you really do need it because it's a way to explain to other people, hey, I have this thing, this is it, it's legitimate. Versus I have this vague constellation of symptoms that really impact me and I don't know what it is. Like, you don't want to tell people that, it's too lengthy and also just doesn't kind of give you the same sense of, I think, closure almost in a way.
Well said. Well, with that, I think we're going to wrap up for the night. Ada and Gracie, thank you so much. This has been an absolutely wonderful conversation. If anyone has questions, please feel free to put them in the chat and we will try to answer them to the best of our knowledge. And in the meantime, just reminders of our social media, the Invisible Illness Network Instagram and the Invisibly Aware Series Instagram, our YouTube website, and the QR code for anyone who's interested. And announcements, in August, we will be covering gastrointestinal conditions. We don't have the date decided quite yet, but you can find it on our Instagram or through our newsletter blast. We will announce it as soon as it has been decided. So with that, I think we'll thank you guys again. And thank you, Morgan, for presenting with me. I hope you guys have a great night.
Thank you.
Thank you for having me.
Thank you. It was so nice chatting with you both.